are described as any method used to prevent pregnancy. There are several examples to contraceptives. One being these birth control pills. They're about 99% effective, and they work by taking each one of these pills every day at the same time, and they're supposed to work by preventing ovulation. Contraceptives and the use of them are usually associated with sex. Sex can be sort of a squeamish topic to talk about between teens and their parents. So, should teens be able to have access to contraceptives without the permission of their parents? Many conservative people would agree with this because the use of contraceptives to them is equal to preventing new life from beginning. But preventing teens from access to contraceptives unless they have permission from their parents puts them at serious risk. Today, in every state, sexually active teenagers can get contraceptives to protect themselves against unplanned pregnancies and sexually transmitted diseases, even if they can't talk about sex with their parents. But some state and federal lawmakers want to take away the ability for teens to protect themselves. They want to prevent sexually active teenagers from getting birth control unless they first tell their parents. Some people say that allowing teenagers to get contraceptives without letting a parent know encourages them to become sexually active, and that requiring teenagers to tell their parents before they get birth control would discourage sexual activity. Studies show that preventing teens from having access to contraceptives unless they tell their parents first will not stop them from having sex. Teenagers don't become sexually active because they can go to a family planning provider, such as Planned Parenthood, and get contraceptives confidentially. In fact, an article on youngwomenshealth.org states that on average, young women in the U.S. have been sexually active for at least 22 months before they went to their first visit to a family planning provider. Another example of this is contraceptives being accessible in schools. Students in schools that make condoms available without requiring parental notification are less likely to have ever had sexual intercourse than students at schools that don't provide condoms confidentially. Therefore, studies and research shows in schools where condoms are readily available, those teens who do have sex are twice as likely as other students to have used a condom during their last sexual encounter. The research shows that requiring teens to show or to tell their parents before they are able to have access to contraceptive services doesn't reduce sexual activity. Um, it will just put their health and lives at risk. In a random study, it was concluded that 47% of sexually active teenage girls said that they would stop accessing all reproductive health services if they had to notify a parent first. Not only would these teenagers stop getting contraceptives, they would also stop getting treatment for STDs, including HIV. Another 12% said that they would stop reproductive health care services or delay testing for HIV or STDs. This means that altogether, 59% of sexually active teenage girls would completely stop reproductive health services. As this research shows, guarantees of confidentiality are one of the prime factors influencing whether a teenager will seek vital health services. If teenagers are prevented from getting contraceptives unless they involve a parent, alarming numbers of teen pregnancy and abortion are likely to increase. Virtually every state has passed laws permitting teenagers to obtain care for STDs and HIV. A reversal of this would just cause serious healthcare issues amongst the younger generation, as well as a serious reversal in the history of the